Hello, my name is Danielle Kassab.
And my name is Sarah Russ.
Brushing your teeth every day is probably a routine that's become almost like second nature. Oftentimes, we don't even think twice about it. We pick up a toothbrush, some toothpaste, and brush our teeth as quickly as possible before walking out the door. But have you ever given a second thought about what brushing your teeth really affects?
Okay, so let's be honest. Raise of hands, how many of you brush your teeth at least twice a day on a daily basis? Now, how many of you floss your teeth at least once a day? Good job, guys. So now to get us started, let's take a throwback to a true classic and let Antonio tell us about the necessity of floss. Insert video that's 46 seconds long. Although this is a silly and lighthearted video, flossing is something that many people don't realize the importance of and oftentimes don't do because, after all, it requires more time than simply brushing your teeth. However, it's absolutely crucial to maintaining good oral health and removing plaque buildup. People are putting an increased emphasis on good oral health now more than ever because newfound research is finding a direct correlation between poor oral health and poor overall health. What if we told you that not brushing and flossing your teeth can not only lead to poor oral health, but it can also lead to Alzheimer's disease, cancer, diabetes, heart disease, lung conditions?
But before we describe the health problems that can occur from poor oral health, we need to define a word that will be necessary to know, and that word is periodontitis, or periodontal disease. Periodontitis is a severe type of gum disease, and one of the most common human diseases. It's caused from the buildup of bacteria due to dental plaque and starts with the inflammation of the gums, also known as gingivitis. If left untreated, then gingivitis will turn into periodontitis. The gums will pull away from the teeth, which leaves pockets between the teeth and gums. The pockets will then fill up with germs and pus and will deepen as time goes on. If it gets severe, gum surgery will have to occur in order to save the teeth. One serious health problem that can arise from poor oral health is endocarditis. Endocarditis is a rare and life-threatening inflammation of the inner lining of the heart muscle and valves. Bacteria and tooth plaque can spread to other areas of the mouth, causing gum disease. When the gums bleed because of the inflammation, the bacteria is able to enter the bloodstream and attach to the linings of the heart. When the bacteria attaches to these surfaces, it's likely to create growths or pockets of bacteria called vegetations, which can prevent the valves from functioning properly, making the heart less efficient, and in several cases leading to heart failure.
According to Amanda McMillan in Time Health, a study published in Cancer Epidemiology, Biomarkers and Prevention states that women with gum disease are 14% more likely to develop cancer than those with healthy teeth and gums. This is especially true for esophageal cancer, or cancer that develops in the esophagus. The study included 66,000 postmenopausal women from ages 54 to 86 and were followed for 8 years. During the study's follow-up period, about 7,100 of these women developed cancer, and overall, those who had a history of periodontal disease were 3 times more likely to develop esophageal cancer and nearly twice as likely to develop gallbladder cancer than women without periodontal disease. Their risk for lung cancer, skin melanomas, and breast cancer is increased by 31%, 23%, and 13% respectively.
Periodontal disease can lead to a higher risk for respiratory infections, including pneumonia. The infections are caused by bacteria from the upper throat, which we inhale into the lower respiratory tract, and is one of the leading causes of death in the United States. According to Jenny Green from Colgate, there is a clear link between poor oral health and the chronic respiratory disease. In a healthy mouth, there is beneficial and harmful bacteria that exist in equilibrium. However, when this harmful bacteria grows out of control, it can cause oral health problems, which then lead to other more serious problems. When periodontal disease starts to break down oral tissues, it allows oral bacteria to leak into the bloodstream and ultimately access the lungs.
Research from Columbia University College of Dental Medicine, who partnered with Colgate, found that poor oral health can lead to premature births and increased time to conceive. They found that during pregnancy, women are more likely to develop bad oral hygiene that can lead to periodontal disease. The researchers found that about 18% of premature births in the United States were linked to this disease. Inflamed periodontal tissues produce a significant amount of pro-inflammatory cytokines, which are cells that promote inflammation, and it has been found that bacteria that causes inflammation in the gums can actually travel into the bloodstream and target the fetus, leading to premature labor and low birth weight babies. This suggests that there is a need to expand preventive measures for pregnant women, along with the gynecological and dental professions.
Diabetes and gum disease are more related than you would think. Laura Martin from the Case Western Reserve University School of Dental Medicine found that periodontal disease is the most common dental disease affecting those living with diabetes. Periodontal disease actually affects almost 22% of those with diabetes, which is more than 29.1 million people in the United States. It is true that people with diabetes are more likely to develop serious gum disease. However, research is now finding that gum disease can cause blood sugar levels to rise, which in turn makes diabetes harder to control.
According to Whiteman from Medical News Today, researchers from the University of Central Lancashire in the UK discovered the presence of a bacteria in the brains of patients who had dementia. This is usually associated with people who have periodontal disease, which again is a type of gum disease. In the study, which was published in the Journal of Alzheimer's Disease, 10 brain samples from patients who had dementia were donated for analysis by Brains for Dementia Research, as well as 10 brain samples from people who did not have dementia. Upon examination of the samples, it was discovered that the bacteria were in the sample of brains affected by Alzheimer's. This bacteria is found in oral cavities and is thought to enter the bloodstream through daily activities including chewing, eating, and brushing your teeth. Each time the bacteria reaches the brain, it can trigger a response from the immune system, which in turn causes the release of excess chemicals that kill neurons. This causes symptoms such as confusion and deteriorating memory, which are typical symptoms of Alzheimer's.
It's clear that good oral health carries even more importance than you might have previously thought. The best way to make sure that we maintain proper oral health is by visiting the dentist to ensure that our teeth and gums remain healthy. However, most dental insurance plans can be expensive and require a monthly or annual premium. Most people won't even get dental insurance and would rather pay the full cost. However, some dental procedures can be extremely costly, and without dental insurance, people might not be able to afford a necessary visit.
United Healthcare is a dental insurance company, and we will be talking specifically about their dental primary plan. Through this plan, people are still required to pay a $25 copay for cleanings and x-rays, 30% after deductible for fillings and extractions, and the full price for root canals and crowns. Typically, as a person gets older, they will need more fillings because of cavities or crowns to protect the outside area placed, which will further add to the cost.
Another dental insurance company is Delta Dental. As part of their individual basic plan, a person would have to pay a monthly premium of about $21. Although they would not need to pay for office visits, exams, x-rays, and cleanings, they will have to pay for the more expensive procedures. In fact, through this plan, a person would have to pay for 50% of their fillings and 100% of root canals, extractions, gum treatment, denture repair, and crowns. This plan appears to be affordable for those who already have good oral health and only need routine maintenance. However, it can be extremely expensive for those who require more significant procedures.
Would you be surprised to find out that dental insurance only started about 40 years ago? In fact, according to Thomas P. Connolly on the Huffington Post, dental insurance first started in the mid-60s to 70s. Delta Dental offered insurance with a $1,000 cap in 1972, and $1,000 bought a lot of dental care in 1972. Today, the average cap on dental plans is $1,000. That's right, it's still $1,000 on average. This means that in about 40 years, the benefits have not gone up on dental insurance. So what does a typical procedure cost without dental insurance? The cost of a single porcelain filling, which is done to fix cavities, can range anywhere from $250 to $4,500. A tooth extraction, which is needed when a tooth cannot be repaired, can range from $75 to $650, depending on the type of extraction needed to be done.
Crowns are needed to be done to protect a tooth on the outside area, which will normally be followed by a root canal treatment, another expense. A single porcelain crown can cost up to $821. A root canal, which is done for an infected or damaged tooth root and usually done after the crown, can cost from $120 to $185, depending on the type of removal needed to be done.
So you can see how expensive dental procedures can be, even if you do have dental insurance. In order to avoid needing to have expensive procedures done in the future, we encourage you to take proactive steps now that will lead you on the right path to maintaining good oral health. First, you can invest in a better toothbrush, but don't worry, you don't need the fanciest electric toothbrush on the shelf. If you brush with bristles that are too tough, you can actually hurt your dental health without even realizing it. The harder the bristles, the easier it is to brush too hard, leading to enamel loss and receding gums, so it's recommended to invest in a soft bristle toothbrush.
Next is to remember to floss. A national survey of 2,000 adults actually found that more than 1 in 4 people lie to their dentist about how often they floss. Flossing is the only way to remove food that gets stuck between your teeth before it turns into plaque. Flossing only takes an extra 5 minutes or less, so take that extra step to keep your gums healthy and prevent from getting health problems in the future.
Get an antibacterial mouthwash. Using a mouthwash will help to access crevices and clean off germs on soft tissues that you might not always brush.
It's also recommended to drink tap water. Tap water contains fluoride, which is beneficial to your teeth. Fluoride is actually a natural element that strengthens teeth and prevents their deterioration. It is found that fluoride helps prevent tooth decay by making the tooth more resistant to acid attacks from plaque bacteria and sugars in the mouth. American Dental Association notes that fluoridating the community water supply reduces tooth decay by 25% in kids and adults. Now that we have given you some tips and tricks, we encourage you to implement them in your daily routine so that you can continue to live a healthy life in your future. If you're already doing most of these tips, then that's awesome, and continue to do that. By just doing these simple tasks, you can significantly lower your risk of developing poor oral health and therefore maintaining good oral health.
So before you rush out of the door in the morning, make sure you be more like Antonio and always brush and floss your teeth. Take a new interest in maintaining good oral health. You never know what you might be preventing in the long run.
I'm Danielle.
And I'm Sarah.
And we believe that the effects of poor oral health is an idea worth sharing. Thank you.